It's all about how do we get inflammation there. And, we've been putting together protocols and packages for patients kind of one-on-one where we can really show, hey, these tools are going to give you the best basis to help your body recover and go over this.
Hey guys, welcome to the Healing Reset. We have Dr. Green with us again to talk about long haul COVID, or just, hey, we've all experienced the virus at this point. What do we do afterwards? What do we do to make sure that our body can heal and recover and get back to balance? So thank you for sharing just a quick little snip, Dr. Green, to help people think through how to treat their body post-COVID.
Yeah, definitely. Thanks for continuing to have me on. So, they use the term long COVID, that can be considered post-COVID syndrome, long haulers, basically it's what happens after.
Hey, really quick, Dr. Green, I heard that long haul COVID was legitimately these people who were experiencing COVID symptoms after they even healed from the virus, and they band together and started calling themselves long haulers, like long haul truck drivers, of like, we're going to endure this long haul COVID. Is that true?
I honestly haven't heard that, but that's really interesting. And frankly, I would hope that isn't the case, because I don't want to see people just taking on that identity, because then we're going to misdiagnose them. We're going to mistreating them with that. But I do know that, 60% plus of COVID patients who have supposedly recovered, they're showing still have inflammation. And if you've been hospitalized and you made it through the hospital, the majority, like 70% plus of hospitalized post-COVID patients, have symptoms coming out. I mean, it is so prevalent. So definitely, I think when you talk about this, you've got a period of relief and then symptoms. It's like a roller coaster where things come and go. And, the symptoms, we know that, it can be fatigue, it can be brain fog, pain, GI issues, vision problems,
shortness of breath.
Absolutely. Yeah.
Leg cramps. I have a friend who's experiencing exactly what you're saying, the roller coaster of symptoms post virus.
Absolutely. So, when we talk about treatments that are out there are a few things that studies are starting to really show. Again, vitamin D, we want those levels, and you want really your levels on a traditional vitamin D blood test to be 70 or 80 at least. So you're looking for higher vitamin D levels. There are several different medications that are out there that are kind of showing, but I'll kind of stick towards supplements and natural approaches, if you will. And, vitamin C and A, vitamin zinc, quercetin, lutein, which is kind of an antioxidant that belongs to something called carotenoids. We find this in a lot of foods. That helps to reduce oxidative damage. Green tea extract or echinacea are big ones potentially. And I've also seen some protocols for the antiparasitics like ivermectin being used with long haulers. But again, I think there's a lot of other things. I've seen some studies with something called N-acetylcysteine, which is a precursor for glutathione, and think liver detox, helping with people who have that loss of taste or smell. We know that proteolytic enzymes can break down problems that are driving inflammation in the body. Black cumin seed oil is another one. It's all about how do we get inflammation there. And, we've been putting together protocols and packages for patients kind of one-on-one where we can really show, hey, these tools are going to give you the best basis to help your body recover and go over this. I think if you've got a office anywhere near you that does IV therapy, or even if you go to like a hydration type clinic, adding in things like alpha lipoic acid or high dose vitamin C are also potential tools that we can really see. And it's interesting with vitamin C, if you take it orally, you're just not going to absorb it. You really don't. And so when you go into the intravenous approach, that kind of IV drips that you can get almost everywhere now, what you end up getting is 100% absorption in your cells.
Versus like potentially 20%, correct?
Yeah, you're absolutely right about that. Definitely. And we need that. We need that higher level. So I would also say, if you don't want to take the ivermectin or the prescriptions, or if you can't get them, wormwood is a decent alternative.
Say that again.
Wormwood. Yeah, which is a natural botanical that's used as kind of a natural antibiotic or natural parasite. And it works very similar mechanism wise for ivermectin, or fenbendazole is another one. You think about like the antiparasites that are out there. And there's some other ones. I mean, you can see, I said green tea extract. We use that a lot with our autoimmune patients, with our hormone patients, with our cancer patients. But you can use it to help kind of bring down the inflammation in the vascular cells. You're talking your arteries, your veins. There's so much inflammation there that comes about because of that COVID cytokines kind of drive. And you talk about, like you said, the trouble breathing, trouble kind of recovering. Seeing that calm down can really help patients start being able to exercise again, being able to be active again, and kind of push their body the next direction.
What has been the average you've seen to get over the long haul COVID? Is it months? Is it weeks? Does it vary?
It varies. It does. I mean, in our clinic, we use IV therapy. I also use something called PEMF, which is pulsed electromagnetic field therapy. And for the lung issues, for the recovery perspectives, that's been really instrumental in helping patients.
How do you place them?
So for PEMF, we use rather large pads, really over the chest and then behind the chest.
Okay.
So we basically hit front and back. And it's also about time. I mean, we're going to push you on there for 90 minutes plus. And we're really going to give your body a longer ability to reduce that inflammation, to improve that circulation. And then with PEMF, when you go into an acute setting, it can actually take tissues that are damaged and it can change them. It allows your cells to kind of shift back towards normal. And we actually see a healing effect that occurs.
EMF is amazing. It's an whole untapped industry.
Yeah,
People
absolutely.
don't know enough about.
You're absolutely right on that. And the IV therapy, IV ozone, if you're lucky enough to have a clinic near you that does IV ozone, that's another tremendous oxidative therapy. They pull blood out, they add ozone to it, then they give it back to you. And you get that drip back in. And it's like the biggest immune boost that your body could ever get. And it can be so fantastic for recovering from long haul COVID.
Okay. Guys, you heard it here. We have so many questions coming in, how to treat the post-COVID virus. And so those are starting places. Consider them. Thank you so much, Dr. Green. I just, again, appreciate what you do for these patients and what you just did for the Healing Reset listeners. Thank you.
It's been my pleasure. Definitely.
This podcast is for informational purposes only. Statements and views expressed in this podcast are not medical advice and have not been evaluated by the FDA. Opinions of guests are their own, and this podcast does not endorse nor accept responsibility for statements made by guests.